Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. Dr. P.C. Rath has been elected the president of the prestigious Cardiological Society of India for the year 2023-2024, the 74th annual conference of CSI, which is a national body of cardiologists of India and Indian cardiologists settled abroad, comprising over 5,000 members, was held in Chennai on December 10th and 11th. A medical student who has not undergone clinical training was like someone who has learned the theory of swimming but has never entered the water, and as such students should not be allowed to treat Indian patients under any circumstances. Advocate Gaurav Sharma, appearing on behalf of the National Medical Council, told the Supreme Court. A shocking case has come to light where a man cheated a construction businessman in Pune of rupees 44.5 lakhs on the pretext of getting his daughter admitted to a medical college. A case has been registered against Mayur Shashikant Malani, a resident of Kikatwadi, Singhahad Road. The construction businessman living in Model Colony has filed a complaint at Deccan Police Station. To increase transparency and streamline procurement process, the AIIMS administration here has decided to set up a digital library on which all supply and work orders will be made public from April 1st next year. The Procurement Digital Library, a repository of all the supply and work orders, will ensure transparency and thereby reduce the burden of RTIs related to procurement at the institute, according to an office memorandum issued on December 9th.
Urinary incontinence is a common complaint among adults with severe obesity. The majority of adults with urinary incontinence who undergo Roux-en-Y gastric bypass or sleeve gastrectomy, the two most common types of weight loss surgery, can reasonably expect enduring improvements in urinary incontinence, according to a new study published in JAMA Network Open. The research team followed 1,227 men and women enrolled in the longitudinal assessment of bariatric surgery 2 study. Participants who had a median age of 46 prior to surgery were surveyed about urinary incontinence episode frequency before and annually after surgery. In good news for those who don't like playing sport or going to the gym, new research finds just 3 to 4 1-minute bursts of huffing and puffing during daily tasks is associated with large reductions in the risk of premature death, particularly from cardiovascular disease. It is the first to accurately measure the health benefits of what researchers have termed vigorous intermittent lifestyle physical activity, or VILPA for short. VILPA is the very short bouts of vigorous activity up to 1 to 2 minutes we do with gusto each day, like running for the bus, bursts of power walking while doing errands, or playing high energy games with the kids. Patients with moderate to severe atopic dermatitis who participated in a clinical trial of rosatinlimab, a novel patient-tailored monoclonal antibody therapy, showed promising results both while taking the drug and up to 20 weeks after the therapy was stopped, Mount Sinai researchers reported in The Lancet. The researchers said that the results indicate that rosatinlimab has the potential to change the genetic makeup of a person's atopic dermatitis for the long term and possibly help sustain lasting results without continued use. Rosatinlimab inhibits OX40, an immune molecule involved in activating inflammatory cells that play a key role in the development of atopic dermatitis and other inflammatory diseases. A new therapy that makes the immune system kill bone marrow cancer cells was successful in as many as 73% of patients in 2 clinical trials, according to Mount Sinai research. The therapy, known as a bispecific antibody, binds to both T cells and multiple myeloma cells and directs the T cells, white blood cells that can be enlisted to fight off diseases, to kill multiple myeloma cells. The researchers described the strategy as bringing your army right to the enemy. The success of the off-the-shelf immunotherapy called talquetamab was even seen in patients whose cancer was resistant to all approved multiple myeloma therapies. It uses a different target than other approved therapies, that is, a receptor expressed on the surface of cancer cells known as GPRC5D. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.